All right, welcome to our very first tutorial in 2022, where we're going to explore a rather introductory lecture on what really anatomy is and what to expect. And we'll also touch a bit on the terminology that you expect to meet, right? So what we're going to cover, we're going to look at a brief history of what anatomy is, how we came to learn anatomy, and we'll look at the medical terminology that we use in anatomy, as well as the anatomical planes that we use as reference points, as well as the directions and movements that you're going to talk about when you particularly look at the limbs as well as the body wall, right? So a brief history, right? Anatomy was there from the 300s BC before Christ, as well as the 2nd century. And scientists used to actually experiment and practice on dead bodies, which we now see in our gross anatomy laboratories when we do cadaveric dissections, right? And cadavers used to be placed flat on their backs, thus making it easy to draw and reference from that position, which nowadays we see by placing our cadavers on the dissection tables, 90% of the time lying on their back, below the upper limb, the thorax, the abdomen, the head and neck, and the lower limb, as well as the pelvic cavity, and would then flip them to look at the back, as well as the flexor compartments in the lower limb, plus the gluteal region, right? Then there was also artistic anatomy, if you remember Leonardo da Vinci. This you can look up in medical history, right? So as a definition, anatomy is actually stemming from Greek language, right? Anatom, actually meaning cutting up. So anatomy then becomes the study of the structure of body parts and their relationships to one another. But in a way, this then does not really encompass what really is anatomy, because you'd find that there are many components that make up anatomy, the subdivisions of which are gross anatomy, microscopic anatomy, which you may then refer to as histology. Then you have developmental anatomy, that is the embryology part. Then, of course, there are specialized branches of anatomy. And also in the research field, you can look at educational anatomy, there is social anatomy, and so forth, right? But for the purposes of learning, we'll be restricted to these three, right? Then to learn gross anatomy, it can either be regional, it can be systemic, or it can be surface, right? Between regional and systemic, for the Zimbabwean education, we learn using the regions. So you start with your upper limb, you proceed to the thorax, then the abdomen, the pelvis, then you go to the lower limbs, then you come back to do the head and neck. Then lastly, you finish with neuroanatomy, right? Then there is systemic anatomy, whereby you can do cardiovascular anatomy. You look at all the structures that are involved in that system. You can look at endocrine anatomy. You'll be looking at all the structures that are actually involved within the endocrine system. Then there is what we refer to as surface anatomy. Surface anatomy is basically studying internal structures in a way in a way they relate to the superficial or the overlying skin. For example, we can say that the oblique fissure of the lung follows a course that starts from the root of the angle of the scapula all the way anteriorly to the level of the 6th costochondral junction. That's surface anatomy. Or we can even look at things like the transverse ridge of the sternal angle. You can talk of the surface anatomy and the borders of the lung. You can demarcate those. Same applies with the borders of the heart. So that then becomes surface anatomy. You are studying internal structures as how they relate to the overlying skin. Because remember, as a physician or practicing physio, OT, or whatsoever, it's not always that you're then going to cut up someone. Sometimes you need to palpate, sometimes you need to percuss and stuff like that, right? Then microscopic anatomy, there is cytology, which is basically the study of the cell, which almost everyone who is joining medical school who have a brief knowledge of from your biology, right? Then there is now histology, which then becomes the study of tissues, where you now look at the 4 basic connective tissues for starters, right? You talk about epithelial connective tissue, you talk about connective tissue proper, right? You talk about nerve, then you talk about muscle, right? Then developmental anatomy basically looks at embryology, how you come to have the body parts before birth, how they are formed from the first week post-fertilization all the way to the 9th month where you then conceive. So you start off looking at the first week, the second week, the third week, then you look at the period that is the organogenesis period from the 4th all the way to the 8th week, where you have the major systems in the body being formed. For example, the cardiovascular system. The heart actually starts at day 22, right? Then the specialized branches of anatomy, you can look at pathological anatomy. This is the study of structural changes due to disease. So anatomy, you're looking at the normal structure. Pathology, right? Then that means patho means suffering. So you're now looking at the changes that are coming as a result of the suffering, the disease. Then there is radiographic anatomy, which basically looks or visualizes internal structures using an X-ray, right? Then there is molecular biology, which is the study of anatomical structures at a subcellular level. What is happening at the genetic level, at the nuclear level? Which molecules are initiating the cell differentiation? Which molecules in embryology are initiating formation of smooth muscle, maybe the myogenes, MYO, which molecules are initiating the formation of etc. and etc. Right? That's the molecular biology, which is also a specialized branch of anatomy. Then moving further on to medical terminology, right? The basic anatomical terminology, we look at this picture. This is a lady who is facing you from wherever you're watching with their anterior body surface, right? The head region is what we refer to as the cephalic region, right? Then the lowermost portions are what we refer to as the caudal regions. So we can say it's a cephalocaudal pattern, right? Then the neck region, we can refer to it as the cervical region, because at the very back there, you have the vertebral column, and particularly in the neck region, you have the 7 cervical vertebrae. Then we all know the eyes, right? You know the nose, the mouth, the ears, the otic. When you do your developmental anatomy, appreciate that at around day 22, you're going to have otic placoids and optic placoids appearing. The optic for the eyes, the otic for the ears, right? Then this is your thoracic region. Remember we said we do regional anatomy. Thoracic region, you have 12 thoracic vertebrae posteriorly. This is the abdominal region. That would be your pelvis, and the genitalia region would be your perineum. Then these are the lower limbs, and these are the upper limbs. The lower limbs, just like the upper limbs, will be divided into the thigh region, the leg region, and the foot region. Similarly, in your upper limb, you're going to see the arm, the forearm, and the hand, which will have a palmar surface, is this surface, and a dorsal surface. If you then look at the lower limbs, the dorsal surface is the one that is on top, that is the dorsum of the foot, and the plantar aspect is what you step on, right? Then this is the navel, right? Your umbilical region. Then turning posteriorly, this is going to be the back, the dorsal region. This is the lumbar region because you have the five lumbar vertebrae in that region. This is the gluteal region, commonly referred to as the buttock region, right? Then you can still appreciate your lower limbs and the upper limbs, but from a dorsal view. This is going to be the base of the skull, where you're going to have the occipital bone, right? The occiput. Then some anatomical terminology. We have what we refer to as superior and inferior, right? If I'm to annotate this in any way, let's say this is the roof. This is the floor, right? This, let's say we have our body, to put it in a cartoon form, right? This becomes superior, this becomes inferior. The anterior surface, where we are going to appreciate the eyes and everything going down, that's anterior. Posterior is behind. Others would like to use ventral and dorsal respectively as well. But when you go to embryology, this is actually going to be different. I'll then refer you to a dog or a cow, where you're going to have something like this and the head somewhere there. Then you have the legs somewhere down there. This surface here, where you're going to have the nipples of those animals, that is actually going to be the ventral surface, whilst the back will be the dorsal surface. That is what you're going to use dorsoventral for in embryology, because the developing baby will not be this straight. Then proximodistal, using the body wall, let's say here the shoulder joint. Structures that are closer to this body wall, they are proximal. Then those that are further away, these structures, we refer to them as being distal, right? Then the words medial and lateral, would like to use them more in reference to movements. So movements away from the body wall. If I'm to use a more clearer picture, movements that are going to be away from the median sagittal plane, this one, those are lateral movements. Then movements that are going to move towards this median sagittal plane, which I will describe shortly, those are medial movements, right? Then coming to this position, this is what we refer to as the anatomical, right? Which is actually the standardized method of observing or imaging the body that allows precise and consistent anatomic references. So all the normal anatomy that you're going to describe, it is going to be in reference to this anatomic position, whereby you're going to be standing upright, facing the observer, in this case myself, head level, not down or up, eyes facing forward, feet flat on the floor. You place the arms on the sides, like here, and the palms are turned forward. They face ventral. Why is this important? Classic example, in your upper limb, when you then describe, let's say, a surface landmark like the anatomical snuff box, for you to be able to have a correct description of the anatomic boundaries, you need to use reference to an anatomic position if you're going to correctly define the medial and the lateral boundaries. Because if you turn those palms, right, that becomes disrupted or I don't know what word to use there, but it then ceases to make sense, or it changes from the normal anatomy that you describe, right? And the positions of the body and the movements, they are usually along one of the three major body planes, which I will show shortly, right? I described the superior and inferior relations, right? Inferior being more closer to the feet, superior being more closer to the head region. Anterior, posterior, we described. Medial, lateral, we described, right? Proximal, distal, we described, right? So these you're actually referring to the roots of the limbs. For example, I gave the shoulder joint as a reference point. Structures closer to the shoulder joint in this case will be proximal. Those going further away from the shoulder joint, they are distal. The same can be said for the hip joints. Those going towards, they are proximal. Those moving further away, they are actually distal, right? Then that's your proximal distal. Positions and directions. There's what we refer to as being superficial, right? If a structure is superficial, it's actually closer to the surface of the body in relation to another structure. That we would then say it is deep. For example, in the forearm, you come across two muscles. The flexor digitorum superficialis, meaning it is superficial, in relation to the flexor digitorum profunda that lies in the deep compartment of the anterior compartment of the forearm, which comprises about 3 muscles. Profunda simply means deep. Superficialis, superficial. It will be the only muscle that you find in the intermediate compartment of the anterior compartment of the forearm, right? Then ventrodorsal, we talked about this. Then there's what is known as the supine position, whereby you lie on your spine, back down, face up, or in relation to the palms of the hand. The palm of the hand will actually face towards the sun, to the sky. Then lying down, you can have what is known as the prone position, right? Lying down with the face facing down, just like a pro baseball player who is sliding into home. Then in between the two positions, you can then say you are in the mid prone position. You are in between supination and pronation. Classically, an example would be the effect or the action of a muscle in the lateral compartment of the forearm, which is going to be the brachioradialis, right? Then you have unilateral and bilateral. Unilateral, it pertains to only one side of the body. Then bilateral pertains to both sides of the body. So you can have a unilateral structure that only exists on one side. For example, the spleen only exists on the left side. Lesion-wise, you can have a bilateral lesion whereby maybe you're having a problem with a nerve or in the central nervous system. Then the effects are going to be spread on both sides of the body. That becomes bilateral, right? Then the planes of the body. You can dissect the body in a median sagittal plane, which is this one. You can use the transverse plane, which is this one. Or you can use the frontal plane, which we can also refer to as the coronal plane. Then, of course, there is a minor one, which is the oblique plane, not very important. For the purposes of learning basic anatomy, you refer to these three planes: the transverse plane, the mid-sagittal plane, and the coronal plane. If you look at the head region, the skull in particular, you're going to find the sagittal suture in that region, which is actually going to be dissected by the mid-sagittal plane. You're going to have the coronary suture in this direction as well, right? Then these are planes of the brain. Mid-sagittal plane, that is the frontal plane, right? That is a transverse plane. Right? This is the same thing that I was describing. Right? And these are fixed lines of reference along which the body is often divided or sectioned to facilitate viewing of its structures. It actually then makes learning anatomy or describing anatomy easy. That is, the sagittal plane equally divides the body into a right and left portion equally, right? Then that is the frontal plane that I said can also be referred to as the coronal plane. It divides the body into a frontal portion, the front, and a back portion. Then the transverse plane divides the body into an upper portion and a lower portion. Transverse plane can also be referred to as the horizontal plane. Still the same concept, different diagram. Median sagittal plane, transverse plane, which is rather a cross-sectional study, which you can use to have cross-sectional studies. If you then look at cellular anatomy, the histology, right? This is a transverse view using radiographic anatomy, right? It has been cut, and here we can appreciate the vertebra. This is the vertebra, right? And these are actually structures that we are visualizing in the body. In this case, we can say these are intestines. This is a frontal plane or a coronal plane, right? Here we can say we are looking at, this is going to be the femur, right? This is part of the femoral perineum, right? This is a sagittal view where we are visualizing the brain from its medial surface, because remember, the median sagittal plane would dissect the body into two equal halves. So we are seeing one half of the brain on that side. This is the brain. That is the lateral ventricle, the cerebellum somewhere here. This is the brain stem. You can see the nose. You can see the pharynx. Here we can appreciate the vertebral column and this structure in between, that is the spinal cord. Then This is more or less an anime that is looking at a bed dissection. But for the purpose of you guys, I won't talk about this slide because we are learning human anatomy, right? That's the end in relation to anatomic planes. Moving on to the movements, right? These are the various movements that we can have, right? Flexion, you have in terms of angle joints. In flexion, you have decrease of the angle. For example, moving your forearm towards the arm, that's flexion. If you look at picture number 10 here, then moving that forearm away from the forearm, from the arm rather, that is going to be extension, right? Hyperextension, you can visualize that using the hip joint, for example. I had a picture for that here. This is hyperextension. Then adduction is moving the hand, or rather the limb or the body part closer to the body wall. Please note, this is different from medial rotation. They can be caused by maybe the same muscles, but they are different. Medial rotation, you are moving towards the median sagittal plane. Adduction, you are moving towards the sides of the body. Abduction, you are moving away from the body, right? You are being abducted to make it. Pronation and supination, we have talked about that. Protraction and retraction would become easy when you describe the jaw movements. An anterior movement will be protraction. A backward movement will be retraction. The same movements can be described at the sternoclavicular joint. Elevation and depression, from the name, they describe themselves. Circumduction, you have a combination of flexion and supination, rather flexion and extension. Then you have medial rotation and lateral rotation. Then you have adduction and abduction. This is a classic movement that you can actually see at the shoulder joint because all 6 kinds of movements are possible. Then you have rotation, which can either be internal rotation, moving inside, or external rotation, moving outwards. Then dorsiflexion and plantar flexion refer to movements of the foot at the ankle joint. One of them is true extension, one of them is true flexion. This you'll come to appreciate when you do your lower limb. However, for the purposes of completeness, dorsiflexion, whereby you're going to be moving the dorsum of the foot towards the leg, that is going to be true extension. Whereas plantar flexion is going to be true flexion. Then, skipping the movements that I've described. So you can have the additional range of movement. As I said, you can have hyperextension, you can have hyperflexion, and so forth. That's the movements that you can find in the body. Then to complete an introduction, you need to appreciate the integumentary system, whereby you'll be looking at the skin and its accessory structures. The skin will actually have accessory structures to include the sweat glands, the sebaceous glands, hairs, nails, and so forth, as well as superficial fascia, which you're going to refer to as subcutaneous tissue that lies just beneath the body. Because when you then describe the anatomy, from the exterior going inside, you expect to meet skin, then superficial fascia, in which you can find cutaneous nerves, cutaneous blood vessels, and some superficial muscles. Then deep fascia, then deep to this deep fascia, you then expect to find some muscles. Deeper to the muscles, you then expect to find some bones. And of course, if you're interested to know much, the superficial fascia is also divided into a fatty layer and a membranous layer. That will become important when you come to describe the anterior abdominal wall. So the skin is the largest organ of the body that you will learn in physiology. And you appreciate that it's going to have the epidermis, which developmentally will be coming from ectoderm. Then you have the dermis, which is this part, which developmentally will come from mesoderm as well as neural crest cells in some regions, for example, the facial region. Then you then have the hypodermis beneath those two layers of skin. This hypodermis is what we are referring to as subcutaneous tissue or superficial fascia. And notice there is that yellow, or there are those yellow colorations there being our adipose tissue. Because remember, I said this subcutaneous tissue is divided into a fatty layer and a membranous layer. Then, of course, the skin is divided into two layers, an outermost epidermis and an innermost dermis. And these two are going to be separated by the basement membrane, which is basically type 4 collagen, as well as some type 3 collagen that you find there. Right. Then you find a loose layer of connective tissue beneath the dermis, which is your hypodermis or subcutis. If you are referring to some veterinary anatomy, you can use such terminology. Right. Then these are some of the facts that you find in the skin. That is going to be the largest organ of the body. 15% of the body weight, weighs about 6 pounds. Not really important to describe much of this, but it's the fastest to regenerate because skin is continually shed off. From the 5 layers of the epidermis, the most superficial strata has dead skin cells, something that you'll come to describe when you do integumentary skin histology. So I will not really go much on this because that's something that is learned later on. Then the major functions of the skin include regulation of body temperature, protection of underlying structures, which is pretty obvious. They excrete water and salt, remember sweating. They receive stimuli for touch, pain, temperature changes, and so forth. Immunity, it's part of the innate immunity. Remember, you can divide immunity into the innate and the adaptive. Then it also has a major function in metabolism. Body temperature, vitamin D, UV light from the sun, that is very important, right? Failure of which you develop rickets in children, then osteomalacia in adults. Pimples and wrinkles, they occur as your skin becomes less elastic with age. Then pimples, acne, I'm sure it's almost every girl's worst enemy out there. And the layers of the skin I've talked about. Then maybe I'll end by showing the 5 layers that you find in the epidermis, just for appreciation from a histologic point of view. You're going to have the stratum basale, the stratum spinosum, the stratum granulosum, the lucidum, and the hornified stratum corneum that you're then going to be finding on the superficial moist surface. This you would describe with skin histology, right? And it is quite crucial to appreciate how these layers of the epidermis would then ascribe thickness of skin. That is how we say this is thick skin because of a thicker epidermis. This is thin skin because of a thinner epidermis. Thick skin will only be present on the palms of the hand and the soles of the foot. The rest is thin skin, despite the fact that we're even going to say that the skin of the back is going to be the thickest skin. That we are referring now to total thickness of the whole skin. But to ascribe and to call skin as to being thick, we use the layers of the epidermis only. So that's just about it. Pleasant viewing.